Dr. Narola Yanger. I am a senior consultant in Advanced Surgical Sciences, CK Birla Hospital. So, a lot of patients present to us with symptoms related to colon. They can either present to us with constipation, loose motions, they have history of passing blood and stool, or they say there is some change in the color of the stool. And also they can present to us with symptoms which relate to anemia, like they have palpitations, they say they have ghabrat, or they say that they have breathlessness on exertion. So to be very frank, I will just divide colon into two halves, the right half and the left half. Left half of the colon generally present with symptoms as I had mentioned earlier, like either constipation, or they can have loose motions, or they present with blood and stool, fresh blood and stool, or they present with some alteration in the color of the stool. And the right-sided colon generally doesn't present with symptoms of obstruction. Because of the slow seepage of blood, they present with symptoms of anemia, like they can have ghabrahat, they can have palpitations, they can have breathlessness on exertion, or climbing a little flight of stairs. So what happens to this patient is, they present to us with these symptoms. The elderly patients, they present to us with these symptoms, and we generally advise, the first investigation that we advise to them is a colonoscopy. In colonoscopy, we generally pass a small little tube that visualizes the entire colon, and whenever there is lesion that is detected in colonoscopy, be it the right-sided or the left-sided colon, a small biopsy is taken and then it is sent for examination. Once it is diagnosed, then we advise the patient to stage the disease. Now, how do we stage the disease? Is either through a PET scan or a CT scan of the abdomen to see whether the malignant or whether the growth is limited to the colon, or it has spread to lymph nodes or the lungs or liver or anywhere else apart from the colon. After the staging is done, we advise the patient for surgery. That is the best modality of treatment for colon cancers, in which we here at CK Birla do all advanced surgeries related to the colon. We make small little holes, around 4 to 5 small little holes in the abdomen, and through that we visualize the entire abdomen in a 3D monitor, in a 3D screen, and the entire surgery is completed laparoscopically. That has a very good effect on the patient, the surgery per se, as well as the laparoscopically, which is totally done laparoscopically, and that gives a very, very good outcome to the patient after the surgery. Now, after this is done, after we remove the colon, as well as the part of the mesentery, as well as the lymph nodes which are there in the mesentery. We send it for histopathological examination, and when we get the report, depending on the report, what is there in histopathological report, which we get after 7 days, the further management is decided. If it is stage 1 and 2, we are good, as we have done a very good surgery. But if it is stage 3, then we advise the patient for further management. So my message to you is, anybody who has these kind of symptoms related to the colon, or even the slightest of symptoms, elderly patients should not ignore such symptoms and should visit a specialist, so that this kind of illness or this kind of symptoms can be, this can be leading to a major thing which can be detected early. And if it is detected early, a proper management can be done and the outcome of the patient would be good. So here, please visit us here at CK Birla, and please get whatever symptoms are there, we discuss with us and we will find a solution for it. Thank you.